Hi everyone, I'm Dr. Thomas dos Santos, and today in this blog we're going to go through why we should be screening sidestep cutting movement quality and how to implement the cutting movement assessment score, also known as the CMAS, which is a recently validated screening tool to evaluate cutting movement quality that we have developed. So since 2017 we published and validated our screening tool known as the CMAS. And our first article was published in the UK Strength Conditioning Association journal known as Professional Strength Conditioning. We then revalidated the screening tool against 3D motion analysis in our study here in 2019, which was published in Physical Therapy and Sport. And then over the last few years, we've had a lot of feedback from researchers and practitioners asking questions about how to use the screening tool. And therefore, we've developed this review article, which contains operational guidelines and lots of information of how to implement the screening tool and how to analyze, more importantly, the videos that we capture from the screening tool. The key thing is we need to be thinking about bringing biomechanical and screening assessments to the field. And this is particularly important at the sub-elite and community level. But this can be simply done using the high-speed recording capabilities of our smart devices, particularly our smartphones and our tablets. So this blog is mainly discussing this review article that we published in 2021. So this is published in Biomechanics MDPI, and this is the cutting movement assessment score qualitative screening tool and how we can apply this to try and inform our training to try and mitigate ACL injury risk in our athletes. So we know there's a whole plethora of negative implications of this ACL injury, devastating implications in terms of health, psychological, and the economical implications. And these ACL injury risk factors are multifactorial. However, biomechanical and neuromuscular control deficits are the key risk factors that we can mitigate in terms of injury risk. But an important step to mitigate injury risk is profiling and classifying athletes potentially at high risk of injury. And a crucial step to do this is to evaluate our athletes' movement quality linked to those high-risk postures, linked to greater knee joint loads. So in this article, we provide a comprehensive overview regarding the rationale and implementation of the CMAS, and we provide some methodological procedures, some operational definitions and training recommendations to assist in the development of more effective non-contact ACL injury risk mitigation programs. So please give our blog a read. We should hopefully find it very useful and hopefully you'll be able to implement it into your practice. Thank you for your time. If you require any further information, please check out the following links. And if you want access to any of the articles, please feel free to contact me via ResearchGate.